Hello and welcome to EUFOREA TV Breaking News. My name is Dr. David Bull. I'm a medical journalist and welcome to our second show of September 2021. Now, this show concentrates on prevention of asthma exacerbations, which was recently reviewed in the Journal of Allergy and Clinical Immunology by two authors who I will be interviewing today. Professor William Busse, Professor of Medicine, Allergy, Pulmonary and Critical Care Medicine at the University of Wisconsin in the USA, and Professor Andrew Menzies-Gow, Consultant in Respiratory Medicine in Severe Asthma, Director of the Lung Division and Deputy Medical Director at the Royal Brompton Hospital in London. Asthma exacerbations remain an important medical emergency, the most frequent cause of acute admissions in children and a major source of morbidity for adults with asthma. In all ages with asthma, the presence of exacerbations is a major determinant of asthma severity. It's important, therefore, that we understand the triggers of acute exacerbations and the mechanisms that underlie them. And, of course, we need to understand the best way of treating these exacerbations. But prevention of these exacerbations is an important metric to measure the success of asthma treatments. Well, to tell us more, I'm delighted to be joined by Professor William Busse. He is Professor of Medicine in the Division of Allergy, Pulmonary and Critical Care Medicine at the University of Wisconsin School of Medicine in the United States. Now, his chief research interests are mechanisms of asthma, including eosinophilic inflammation and rhinovirus-induced asthma. Professor, it is very good of you to join us. Thank you very much indeed.
Well, thank you for asking these questions about exacerbations, because again, as you mentioned in your introduction, this is sort of the linchpin criteria for both disease severity and how well controlled patients are, and how much of a burden the disease has, and also the economic impact that the disease has both on the patient and also on society.
Sure, I completely get that. Now, tell me then, let's start by asking, how big is the problem then of asthma exacerbations in the US?
Well, it is a big problem. I think for patients of all severity, asthma exacerbations occur. Even in patients with mild disease, having one exacerbation per year is not that infrequent. It remains, I think, the major cause of morbidity for patients, that is, exacerbations that requires emergency department care. Looking over the last 10 years, the frequency with which patients go to the emergency room with an asthma exacerbation really has not changed. What has changed is a decrease in hospitalizations. So again, the exacerbation rate really seems to be unchanged, but the severe consequences, that is hospitalizations, seems to be on a decline.
Which is great news indeed. So it means obviously the treatment options are much better. But tell me, what then underlies the mechanism here? Why are people getting these exacerbations of asthma?
Well, the major cause of an asthma exacerbation in children and in adults is viral upper respiratory infections. And interestingly, the predominant virus that brings about these episodes is the common cold infection. Again, all of us get a cold 2 or 3 times a year. We get over it. But if patients with asthma, at least some patients with asthma, get this simple cold, it really triggers off a severe episode of asthma. So again, this seems to be the major cause. In children, it accounts for about 80% of asthma exacerbations. In adults, about 60%. So it's the driving factor. Any viral respiratory infection can do it, but rhinovirus, the common cold virus, seems to be the dominant, whether it's the frequency with which these infections occur or something unique about the virus isn't really entirely established at the present time.
I mean, obviously we're living in very strange times with COVID, and we've adopted very odd behaviours over the last, year and a half and so on. So, and certainly we are seeing far more viral infections, and I think we're going to see more of them as the winter approaches. So are you expecting exacerbations to sort of skyrocket as a result?
This is a very interesting question. Over the last year, with the social distancing, mandated use of masks, the frequency of asthma exacerbations has dropped precipitously. Emergency room departments have had a reduction of about almost 80 to 90% of episodes of asthma requiring the care in these facilities. And I think this is due to simply the fact that the kids aren't in school, they're not transmitting the virus to one another. And again, when we are now out and about, we're wearing masks and the transmission has gone down. What happened was when there was a reduction in the need for the use of masks, the viruses started to reappear, asthma exacerbations started to return. There's been an interesting observation that came out of Canada about 25 years ago, in which they looked at the time of the year in which children had asthma exacerbations requiring hospitalizations. And invariably, 1 week after school started is when these episodes occurred, and they occurred for the next month. And it's now referred to as the September epidemic of asthma exacerbations. And it's really due to the kids coming back into school, having a viral respiratory infection, and transmitting it to one another, and also bringing it home to bring out episodes of infection and asthma exacerbations. With COVID, with the restrictions that were based upon socialization, again, this dropped precipitously. And I think it underscored the importance of viral respiratory infections as the primary trigger to asthma exacerbations.
I mean, the following question, therefore, would be, I suppose, if you're at high risk, would you therefore say, given what we now know, should people continue social distancing, wearing masks, trying to avoid those viruses?
This is, an absolutely key question, and I don't think we have the answer to it. Again, children in school wearing masks it's a very difficult situation. Secondly, the viruses many times will be present in the upper airway or in the nose a day or two before symptoms appear. So sometimes it's really hard to tell if a child or an adult is having an infection, even though the virus is present. It's a virus, the response of the host, which leads to the symptoms, and then the development of asthma. That being said, I think we have learned an awful lot about the benefit, importance, and value of wearing a mask. And one wonders, during high-risk seasons, if patients have asthma and they're going back to school, maybe this would be a good time for 2 to 3 weeks or maybe a month or so to wear a mask. I think it's not an unreasonable thing. And the same thing can be said with adults.
I mean, I think it's absolutely fascinating. For me, the one good thing that's come out of the whole COVID pandemic has become the fact that people are now washing their hands. And I think, any of those kind of easy measures obviously will reduce the burden of disease. Public
health measures work for the public health, or I should say for the health of the public. And I think just very simple things, wearing a mask, washing your hands, because many times the virus gets on the hands, it's transmitted, to the upper airway, including the eyes, and this sets up the infection. And that's why, washing hands can become very important. And I think also staying out of contact with patients when you have a cold. Stay home for a day or two, just so that you're not the vector bringing the virus into the environment.
No, it's a really good point indeed. So let's now talk about the exacerbations. How can the relevant triggers for the exacerbations be recognised in the first place? And I suppose we've talked a little bit about prevention, but certainly how do you recognise them and what do clinicians do about them?
I think, first of all, knowing that there are times of the year where this is more likely to occur than others. For youngsters, kids in up to grade school, grade 12, it's the time of the year when they go back to school, those first 3 months. So I think a heightened awareness in this situation. A very important point is for the physician or the healthcare provider to ask the family or the patient, did you have an exacerbation last year? And what we know that the risk for exacerbations and history of this predilection is a very important key risk factor. And it tells you that these are patients who are likely to have episodes of worsening asthma when they get a viral respiratory infection. For adults, the problems tend to occur, as you mentioned earlier, during the winter months. And again, here, I think just an awareness of what's going on. The second point is a heightened awareness during this period of time. Is your asthma control starting to diminish? Are you feeling a little more short of breath? Are you having trouble at night with your symptoms of asthma? Are you coughing during the day? Are you feeling some tightness in your chest? Just a heightened awareness. And again, for the patient, they can do this. And also for parents, they can have a heightened awareness. Again, I think what we see with parents, they're very tuned into these kind of relationships. And mothers and fathers really can call a physician early on and say, my child has a cold, and it looks like it's moving into asthma. Again, I think they're aware of some of the telltale signs, and this heightened awareness can be very important in trying to prevent these events from going further.
Do you think, and I know this is very difficult to answer, do you think we're going to see long-term behavioural change in terms of public health measures? Do you think that we actually, maybe, if we adopt those measures, we might see a reduction in asthma exacerbations?
This is a very key question. Hopefully we learn lessons from events like as occurred in the pandemic. And again, I agree with you. One of the lessons we've learned is that social distancing and masks work. So again, we hope that, again, these kinds of observations can be translated into patient care. First of all, it's inexpensive. Secondly, it seems to have some validity. And third, again, it's really not necessarily a cumbersome situation, to do this for a short period of time. So I think we're beginning to see this. And again, how this will be translated and brought into sort of care for patients with asthma, I think will evolve over the next few years. It's a very important step forward. Simple step with, I think, a reasonable degree of efficacy.
Perhaps I then could ask you, Professor Busse, is there anything coming down the line that would help clinicians, parents and patients themselves to manage these asthma exacerbations? What's the hope that you think going forward?
I think there's a number of areas in which we can be quite hopeful. I think one of the areas that has been addressed for a number of years is whether or not we can vaccinate against the common cold. Doesn't seem to be eminently available. However, some of the vaccination techniques that have been used in COVID, which is also a coronavirus, which has some similarities to the common cold, may lead to some new breakthroughs. What's most exciting to me has been the availability of biologics. These are monoclonal antibodies, which are addressing very important components of asthma, which lead to disease severity and also to exacerbations. And what we're seeing in patients with severe disease is that treatment with a greater precision for a component of their asthma has as a major outcome a prevention of asthma exacerbations. And what we're seeing in patients with severe disease, and it's also going into children, by using these treatments, which although expensive, are extremely safe, has been a very significant reduction in exacerbations. So again, I think there are, with the increased knowledge of the mechanisms by how these things occur, identifying the pathways which lead to these exacerbations, and getting treatments which can be directed towards preventing these pathways from becoming activated, we can, I think, very significantly reduce exacerbations, and with this, the morbidity and mortality in some cases that we see with asthma exacerbations. This is a sizable step forward.
Thank you very much indeed, Professor Busse.
Very good. Thank you.